Hello, welcome back to the channel. Now, this is a continuation of antihypertensives. Let me talk about SE inhibitors. Now, SE inhibitors inhibit the angiotensin converting enzyme and then prevent the formation of the active angiotensin 2, which is a potent vasoconstrictor, and also they inhibit the degradation of bradykinin, a potent vasodilator. And examples of captopril, enalapril, lisinopril, and very many others that which you know of, used in hypertension, heart failure. They also be useful in DM patients with hypertension. However, due to their inhibition of bradykinin, they also cause the dry irritant cough. However, in case the patient complains dry irritant cough, if you give another one like Arab. The other side effects of hypertension, hyperkalemia. Now, the angiotensin 2 receptor antagonist selectively block angiotensin receptor 1, and then of course we know that this is receptor responsible for the effects for the actions of angiotensin 2. Example of losartan, valsartan, cadastatin, all those and very many others which you have. Remember, most of these drugs can be used in combination with other drugs. I'm sure you're aware of that. Now, the direct renin inhibitors, alskiren, I'm sure you're aware of that, constant to prevent formation of active angiotensin 2. Now, the beta adrenoceptor blocking agents, we have the constant bend to beta 1 adrenoceptors, and inhibit the normal sympathetic flow, which results in decreased cardiac output, and then also inhibit renin release, as I said in the initial slides of renin. We have done selective beta blockers, propranolol, beta 1 selective, atenolol, metoprolol, acebutol, smaller, beta 2 blockers, betazoxamine, and then there are the beta blocking agents. However, they also have alpha effects such as carvedilol, labetalol, and nevibrol. And the clinical uses are used in hypertension, glaucoma, such as timolol, migraine, hypothyroidism, angina pectoris, myocardial infarction, and in arrhythmias. However, sometimes they can also be used in hypertension. Let me stop there. Side effects of bronchoconstriction for the non-selective. GIT disturbances, hypertension, and also disturbances in the metabolism, as they mimic hypoglycemic effects. Remember, these ones are are contraindicated in DM patients and also in asthmatic, especially the non-selective. Now, the other alpha adrenoceptor blocking agents have these ones. They block, of course, alpha 1, causing relaxation of smooth muscle, such as prostacyclin, doxycycline, trazocine. Central acting clonidine stimulate the alpha 2A receptors in the brainstem, resulting in reduction in sympathetic flow. Alpha methyl dopa converted to alpha methyl norepinephrine, replacing norepinephrine. Because in the vesicles, it acts centrally in the sinus to diminish the norepinephrine release from the brainstem. Preferred drug for treatment of hypertension, pregnancy, and insufficiency. Side effects also can have sedation and Parkinsonism. Those are the side effects. Vasodilators can also be used. This they increase release of the nitric oxide within the endothelia. And then of course we know that nitric oxide is a vasodilator. Idarazine, of course, we know it is used in severe hypertension and in eclampsia. Minoxidil, this one causes hyperpolarization of smooth muscle. However, these days it is used in male pattern baldness because this is a side effect. Calcium channel blockers are also used. They block the inward movement of calcium by binding to the L-type calcium channels in the heart, nifedipine, the amlodipine, the verapamil, and lutetium. Now, I'm sure you're aware of the side effects because I'm not talking about the side effects, so it's a short presentation. longer ones are rejected. Let us look at pulmonary hypertension. Pulmonary hypertension, of course, this is blood pressure that affects the arteries within the lungs, often characterized by progressive sustained increase in pulmonary vascular resistance that eventually may lead to right ventricular failure. This is mainly due to vasoconstriction, of course, pulmonary remodeling, pulmonary vascular wall stiffening, or thrombi within the pulmonary arteries. Now, the drugs which are used commonly in pulmonary hypertension, we have phosphodiesterase inhibitors. They inhibit the breakdown of CGMP, leading to relaxation of the smooth muscle. Examples, we have sildenafil, vardenafil, and taldafil. Now, side effects, we have headache, flushing, and sustained penile erection. Now, this side effect is one which is used for when you are using these drugs in erectile dysfunction, because the side effect is this is a side effect. It is not the original use. Now, the others that can be used are prostacyclin agonists similar to nitric oxide, such as epoprostenol. These are the other ones which you have. Refer to them. I always remain Wilson from MPharm Training Solutions. Contact us for more information. Thank you very much.